So how does this technique actually work? All right, so what happens is this. You've got scar. What happens is with a lot of dysfunctional tissue, you get scar tissue. This could be from microtraumas. It could be from some sort of injury that you might have had, or just daily life. Because we can get adhesions through the tissues, and these can cause pain and not allow the muscles and the fascia. Now, when I talk about fascia, think of you've got skin, a layer of fascia, and your muscle, and they almost slide together. But what happens is they sort of get caught up, and this is what happens. You get these what are called fascial problems. So, and fibrotic tissue, and say soft tissue dysfunction, meaning pain. Think pain, or limited range of motion. So this is a fantastic technique. As I say, it's been used for thousands of years. Now, again, in Chinese medicine, they didn't know all about this. They knew it worked. They worked on their Chinese meridian theory, and that was the theory they gave it. Where there's with qi and blood and so on and so forth, yin and yang, and all sorts of things with regard to that. But so now it's become popularized by the Chiropractic Society in particular with a thing called Graston technique. You may have even heard this. This is where they use stainless steel tools. It is basically a glorified gua sha. It is basically so similar to what gua sha is. But really it's a name change, and they just use fancier instruments, if you like. But so what we're doing is you'll see that pinkness as we work along a muscle here like this. One, you may be able to, if you have good skills, you'll feel like the grittiness, like a bumpy road. I can feel it right here. And it's pretty easy to find because this magnifies the feeling. So if you do this, it might be more difficult to feel. But this is like a little, I feel like a palpation microphone. So as we go along, you can feel it. So when you feel it, then you'll work these muscles and you'll get this redness, which is increased blood flow to that area. And then that sets off a healing response. And it also, at the same time, we're going to break down the scar tissue and the adhesions. So then the body will have a slight sort of micro trauma, the adhesions, because you want those muscle fibers parallel. You don't want them in this sort of hex fashion. This is what happens when you get scar tissue lays down. It lays down in all directions. So you'll feel that, and you might see more redness where you've got scar tissue and adhesions. So as we go through the course, and so you can have fantastic results. One, it saves your hands if you're a therapist. Two, you can treat yourself. You can treat carpal tunnel syndrome, all sorts of different types. And in Chinese, and we're going to go through this, they treat things like colds and flus and diarrhea and constipation, all different types of health to affect the organs internally. And I'll teach you that through the course as well. And a lot of it, but all the musculoskeletal things, I'm going to show you how you can treat yourself, and also how you can treat people. And I'll do more advanced work where we'll start to use active assisted work through this sort of thing as we lengthen the muscle and all of this sort of thing as we sort of work, as you can see that as I move my hand, this sort of thing. So yeah, so I'll see if I can just work it through here, and you'll see we get a little bit of redness there. That's what we want to see, and that's creating a healing response there. And as I say, you can have fantastic results with acute patients and also chronic patients. Generally, you see them twice a week, but I'll go into that. Not much more. You want to see the redness gone and any sort of lingering soreness. Twice a week is generally a really good time slot. Yeah, so as we go through, so this is sort of how this is working. It's been working for centuries, thousands of years, and now it's become a lot more mainstream in what they call Graston technique, but it really is a glorified gua sha.